And an important health story that you need to know about this morning. When it comes to poisoning, a lot of us think it's mostly kids, but the numbers show adults account for 92% of all poisoning deaths. Dr. Joseph Leithold is a family physician. He's here to tell us more about this. I think most people heard what I said. 92% of poisoning deaths are from adults, and they're surprised.
Yeah, I mean, when you think about it, though, you shouldn't be, because so many medications are prescribed for adults versus children.
And talk about the reason, I guess, that mostly adults take these pills and kind of aren't aware of the strength of them, or what do you think the reason is?
Well, I think there are many factors, Megan. I think what I would look at, first of all, is timing of medications, dosing of medications, and other medications the patient may be taking.
And do you think they're doing it on purpose, or do you think that it's just kind of a miscommunication between the patient and doctor?
I think it's the latter. I think most patients are trying to be safe with their medications, but may not know exactly how to take them.
And what about allergies? Does that factor into it at all? If someone may be allergic to a medication and they didn't know it? Absolutely.
I think when we use the word poison and we're talking about any substance that might be harmful to the body, we all recognize that allergies are a type of poison for that individual.
And talk about the type of medication that is most common in terms of poisoning deaths.
Poisoning deaths, I don't know that I can tell you exactly one, but I think we should think of them in terms of groups. And I think we should think of the blood thinners. I think we should look at quick-acting medications like insulin. And I'd also look at some of the hypertensive medications too.
All right, so if you take those, do be aware. And if poisoning does happen, what are the first signs of it?
Probably a change in mental alertness. And that may be stuporousness or semi-conscious, and then the patient may go on to full coma.
And what do you do if, you or maybe someone that you live with or love might have that poisoning?
Well, first of all, it's very fortunate that that person was found. Chances are they're going to be found in a state where they're not going to probably be able to give you much information. So you have to be a bit of a detective. Stay with the individual. Look for clues around and be prepared to call 911 immediately after you've done a quick assessment of the scene.
All right, good advice and a good reminder for everyone out there. If you do suspect poisoning, get help, gather the facts. We have more information on all of this on our website, fox45now.com.